So we're getting ready for the panel. We have a couple of questions lined up, but we will be opening it up to the floor. It's already been open, but if you have any questions, please feel free to ask. Manusha is going to come up and kind of intro everyone else.
Thank you so much. So we have great experts here in the panel today. Dr. Greg Buehler, he is the senior faculty in the Department of Emergency Medicine at Baylor. We have a large group of Baylor people here, so
Baylor in the house.
And he's also vice chair of operations and quality in the Department of Emergency Medicine at Baylor. Next, we have Dr. Caitlin Clem. She is the professor of emergency medicine at Dartmouth, previous chair of the Department of Emergency Medicine, and professor of emergency medicine at the Loma Linda University, inaugural president at the Academy for Women in Academic Emergency Medicine. Well, just to mention, the list goes on, but we just selected very few of these past experiences, and the past chair of the Association of American Women Emergency Physicians. Dr. Cheryl Haran, professor and vice chair of faculty equity, engagement, and empowerment at Emory, chief diversity and inclusion officer at Emory School of Medicine, past chair of the emergency medicine section of the National Medical Association, inaugural president of the Academy for Diversity and Inclusion in Emergency Medicine.
I'm just Jamaican with
And of course, the hero of emergency medicine, the American College of Emergency Physicians.
There's lots of words on that slide.
And Dr. Michael Gazandi, inaugural vice chair of education in Department of Emergency Medicine at Stanford, principal and founder of the Precision Education and Assessment Research Lab, co-director of the Scholarly Concentration in Medical Education, faculty advisor for LGBTQ+ meds at Stanford, and distinguished member of Stanford Medicine Teaching and Mentoring Academy. Unfortunately, Dr. Gazandi needs to attend another panel, so he will be leaving a little bit early, I assume, but hopefully we get to ask enough questions.
I think just to start us off, our first question would be thinking back kind of on your professional experiences, how you think gender has influenced both the experiences you've had and your approach when you're having difficult conversations and approaching conflict in the workplace. Let me start with you, Dr. Buehler, and we'll just go down.
I think, and maybe for most of us, but at least for me, a lot of my experiences probably shaped that over the course of many years. Unfortunately, some of those experiences were mistakes, but we all learn from mistakes. I can give an example. I mean, I was junior faculty. I was doing the schedule, and we had several faculty that were going to be on leave, maternity leave, all at the same time. Faculty called it pregnageddon. It was, and I was the scheduler to kind of figure out how we were going to still put out a schedule with no holes. And I made the mistake that was referenced in the talk before about the email mistake. I made that one because several of our faculty who were going to be on maternity leave requested vacation after maternity leave, and it was going to be in a peak time of vacation requests for the rest of the faculty, and I sent a group email to those that were going to be on maternity leave that there was going to be no vacation after maternity leave, and I didn't get very positive responses, as you might imagine. And certainly learned that email was not the right mode of communication in that case. Had individual conversations with each faculty member after that, and I think those were productive conversations. I think we, instead of being positional, we were more principled in both of our approaches. My understanding of their values and their needs, them understanding my really wanting to be able to be supportive, at the same time my fear of having to put out a schedule with no holes in it. So I would say that was certainly an experience that started it, and for a journey for me, and in various leadership roles and many difficult conversations later, has shaped and still have, I still have plenty of room to grow. And I'm sure, I think one thing none of us are perfect, and, we can only hope to learn. Other experiences that have helped shape that, also early in my career as junior faculty, quality was a big part of what I did. And, so any QI cases came to me, so it was my responsibility to have that conversation with faculty, and those are often very difficult conversations, and we certainly need to learn to put ourselves in the other individual shoes and be empathetic during those. So I think that's also something that helped shape kind of my approach to it today.
So I want to make sure I understand the question. It's how has my gender shaped my career and to give an example? Is that what we're looking for?
Your shape, how you communicate during these conflicts.
Okay,
Oh.
all right. So I have two examples that I could use. I'll pick one. One I think that is really important is female-to-female communication. And I think it is something that we have to develop and look at. So is the person you're communicating with stuck in 7th grade where it's all catty comments and put each other down and submarine each other and all those kind of things? Or are you talking to someone who's mature and has a similar mindset that you have, or are they somewhere in between? And I think it's important for us to realize that there are gender-to-gender issues that are there. So I was new attending, and I had what I knew was a great idea, okay? We had a lot of kids in our department, and we needed to move them over and have a pediatric area of the emergency department. So I'm a new attending, and I'm gonna make this happen. So I had this whole plan in my head, and I said, I'm gonna come on at 6 a.m. before we fill up that part.
That's your podcast, though.
Yeah. Then they may have heard that. Okay, I will tell a different story.
They're gonna hear it next.
All right.
They haven't heard it yet.
Okay. Oh, I didn't know they were gonna tell that.
Okay.
So to clarify, the examples you reported with me,
Okay.
they haven't heard yet, so we're gonna say that.
Thanks for the
Okay,
clarification.
thank you for telling me.
Because I was going knee deep into mine, but
Okay. She was gonna do that too.
I
So
was going knee deep.
you
and
saved us
us.
both.
Yes, thank you, thank you.
Then I will do a different one. One is that you need to realize the lens other people are seeing you and see how you can shape that. So I had, I'll just tell you, I was at Duke, and we really needed to have a new physical structure for our emergency department. And I was going everywhere, making a campaign that why we need this new structure, having residents coming in, it's too small, it's antiquated, all of the reasons. And I was getting nowhere. And at that time, it wasn't emails, it was memos that were sent out. And a memo accidentally made it to my desk where several hospital administrators were talking about why we didn't need a new emergency department. It wasn't the kind of patients that we wanted to attract because we wanted to be a tertiary quaternary center, and having the emergency department be a little bit crowded and a little bit of weight is probably better for the whole institution to help us get where we need to go. I was horrified. So I made an appointment with the person who was sending out that memo, and I went to meet with him, and I just said, I want to talk about the emergency department. Well, of course he's going to say yes. I'm the division chief. He's going to talk to me. So I walked over and I put it right in front of him, and I just said, can you help me understand this? He hemmed and hawed around it, and essentially just tried to explain how I really didn't understand the finances, and very, very condescending. And if I really understood what was going on, it would actually help the emergency department if we did all those things. Essentially, he was patting me on the head and saying, there, little girl, you just don't get it. That was how I felt coming out. I went out steaming. Karma did help me in this case, but the next day, I kid you not, he had his big MI, in his
Yikes.
office and was brought into.
You got that kind of power? Wait, what's Cece?
I'm on duty.
That's some kind of power she
I am
got
on
going.
duty. And there's no place to put him in the whole department. There is nowhere to put him. I put him right in front of the nurse's station, and I practiced compassionate medicine
Look at you.
for him.
There you go.
And I got him to the cath lab, got everything done, and he got his stent placed and without ongoing myocardial damage. And when he was finished,
I know.
he came back to the emergency department in person and said, "You'll get your new department." But
That's
what I'm
one way
going
to
to
do
tell
it.
you is, what I did there was actually to showcase competence. So when someone sees you through one lens,
True that.
sometimes you have to show them a different view of what you do.
That's right.
Now, I was given a wonderful opportunity to do that, but I will show you, I was a competent
attack for you.
emergency physician, and he had to see that. Okay, go ahead.
Oh, thank you. All right, so good afternoon, everyone. My name is Cheryl Herron. My pronouns are she, her. And so I think I'll take it from the lens of what I've always experienced, which is, what do people see first? Do they see that I'm black? Or do they see that I'm a woman? Or do they see both? And I think the one thing I can leverage around that communication, which is, I guess, a positive one, was when we were recruiting to emergency medicine at Emory one year, and we got 15 men, one of whom was black, and one woman that whole year. And Arthur Kellerman, who I can easily say, said to me, "Well, Cheryl, I need you to stand up there." And it's not a conflict, but it was just more in a positive way, where he was exhibiting leadership and recognizing that there was no diversity, at least certainly from a gender or a race perspective, in emergency medicine at the time. And initially, I was taken aback, but then I knew Arthur Kellerman, that he wasn't being sort of, funny about it. He was being serious about it. But I laughed and I said, "Well, do you want the woman, the black woman, the Jamaican, the New Yorker, which representative?" And I always wonder about, in the communication, do I have to send a representative versus my whole self, which is multiple pieces of who I am. So the communication really emanated about bringing that forward, and recognizing that that could be a lens through which people get 2 for 1 in the diversity lane, but I just put it out there as a way to sort of remind that it's not 2 for 1, it's one person with multiple identities, of some of which we see in our diversity, some of which you don't. And I think that taught me how to frame things in a way where, while I felt like an ouch, wow, yeah, I need you to stand up there. What do you mean? But it helped me reshift and reshape his motive and intent, which was to be reflective of all facets of diversity. But I couched it in a way where, because some people might have been offended by that, but I had to rethink and remind myself what the intent was for him, which was to really have diversity in the residency program. So I took it as an opportunity to sort of laugh and say, well, which representative, but also at the same time amplify and support the fact that we actually needed diversity in that space. Yeah.
What did they say when you asked him?
He laughed, "Oh, sure, bring all of you." He said, "Actually, I want all of it." I said, that's the right answer. So it was, it was a sort of a visceral response, because I was just sort of, "I need you to stand up there. I mean, what's up with that?" Was my first response. But then, knowing him, I knew what his intention was, which was to really, we were deficit in both domains, but being one with an obviously intersecting identity, I sort of was a little bit, if I didn't know who he was, I could have taken it in a different direction. But so I had to pause, reset, rethink, and remind myself that I trust him, and that his goal was to really be aghast at the fact that we had one woman and one person of color out of 16 residents. And so I had to reframe and reset my initial response to what the intent of the query was. Yeah.
Mine is short. When I was program director at Northwestern, one year I matched 13 women and 2 men. So we call that the all-girl class. Those 2 men were irrelevant. It was just, And on match day, I had a half dozen phone calls from male attendings telling me the catastrophic mistake that I just made. And as if I made the mistake, the match gods give you your class, right? But, I found myself in this position trying to defend the class before they had arrived. Like, we had the list for hours. And, my initial response, and I still to this day don't know if it was the right one. I said, I'm going to be really proud to train 13 women leaders in emergency medicine. That's what I'll be proud of. And it didn't work. Like, they're like, they're all going to get pregnant, and then they hung up the phone. But it was, it was really eye-opening how sexist the department was. And that was the trigger. Like, you wouldn't have known it unless we matched the all-girl class. And when we did, it all, unveiled itself. So anyway, there was a lot of conflict, male to male, me to other male attendings throughout their 4 years. There was just, it never ended.
Wow.
Yeah.
So did you have to do what I was saying, where those residents had to show?
Oh,
they
yeah.
had to prove themselves.
Absolutely.
Just like I was saying, they had to, the residents themselves had to reframe.
Wow.
There were a couple pregnancies, that's okay.
Yeah.
But, as soon as the first one hit,
Oh,
I got
that
calls.
was the ripple effect.
Yeah. 2 of them got in a heated battle in the middle of the ER once. And that wasn't good, right? You can't have emotions.
Right.
Right, you can't have that. So, these are the little trigger things were, blown out of proportion. So the competency thing was paramount. All women chiefs, probably because they proved themselves in that way.
To follow up on that experience that you shared, so a lot of the experiences that you mentioned were when you have been experiencing a difficult situation, but I guess in your case you also had to manage a lot of difficult conversations that has been going on and you were observing that. How could you step in? How could you support your residents or other junior colleagues when they were having these difficult and challenging conversations?
I want to make sure I understand the question. So when they were having difficult conversations with whom?
Yeah, as a person who is not experiencing the situation themselves, but as a person that you want to support your residents
Right.
or your
Oh.
colleagues. when
I
they're
see.
going through this.
Yeah, I think all of my statements were in support of them. And I don't know that they ever, I'm sure they got treated poorly because they were women, because I found out that all of my male colleagues were sexist. But, I don't know of individual difficult conversations they had around this particular issue with the attendings. It was the attendings to me, constantly, for 4 years. Yeah. It was shocking to me.
Wow.
Yeah.
Okay. Hello, Stanford.
No. That's why I went to Stanford, right? That's why I went west. Go west, boy. Go
Go
west.
west, young man.
But if you want to talk about your experience as a leader, how do you think you can support your junior faculty or your residents? Or how you can empower them to be able to manage this?
For me, I'll just say this. Interestingly enough, I never, it's going to sound, I've never really had a problem with my gender, right? And it's interesting because growing up, I was a tomboy. My brother and I are 11 months apart, and I would get picked for all the sports team before some of the other dudes. And so I never really, people said, man, you have more testosterone and balls than most guys I know. And I don't know if that's a compliment or I didn't know how to take that. But because I'm not trying to be a guy, I'm just who I am. But what's interesting is that became a blind spot for me. So I remember I was leading my executive committee, and I looked around, and my admin sent me a text, and she said, yep, there's Cheryl and the boys. And I was like, what do you mean? And she said, don't you know you're the only woman in here? And I was like, oh, shit. So I looked around, and I was like, oh, my God. I didn't even really notice it, right? So my blind spot was not recognizing my own, because I was just handling my business and doing my thing. And that was an aha moment for me. So I used my leadership role to expand our executive committee to ensure that there was proper representation gender-wise. And just at our last exec meeting, we had more women than men in the meeting, but it's the intentionality piece around, if even as a woman, if you don't notice things or something, brings it to your attention. Because my gender was never what I was, as a little girl, never challenged by, so much so. So it didn't become front and center to me until somebody said, you're the only woman in the room. And I looked and I said, oh my God, okay, we got to fix that. So I used my leadership lens to fix it.
In terms of supporting your faculty, our department just went through an 18-month consultation around gender issues. We hired a consultant to come in because there was numerous sort of low-level sexual harassment accusations going on in the department that made, in general, the women feel very uneasy. And this was despite a department where the chair and the residency director and multiple other directors are all women. It was still, a gendered department. So we just paid a disgusting amount of money to bring in this consultant who then met with every single faculty member, resident, and staff member in our department to give them tools to be up standards when they hear microaggressions and mechanisms to report instances of gender discrimination. So I think there's some opportunity for formality sometimes, and I'll say on the back end of the 18 months, the environment's just entirely different. It's, I think issues of gender discrimination are just simply not tolerated, period. And, it took that level of administrative effort to get there, but it was definitely culture change.
One of the ways that I like to support my women residents, is to help them to support each other. So when they notice one of their colleagues do a really good job on something, talk about it to the whole group. Ruth did a fantastic job on running that resuscitation. She organized the room, and now the patient is doing really well, and point it out to each other and to the group. So, and also when you're in a meeting, to amplify what the other one says. So I help my residents do that. So I want to build off of what you just said. And so you amplify what you see your women colleagues doing. And that's something we can just keep it in our mindset to do, and start early on in residency to do that, and then continue that throughout your career. Is look for ways to build each other up and point out the good that we're doing, and amplify it.
Yeah.
Like a lens of sponsorship all the time.
Yeah.
Yeah.
Can I ask a follow-up question? So I think it's really easy for us who, depending on what our worldview is, to sort of separate gender into the binary, the male and the woman and the man. I'm curious from y'all about your experiences with trans and non-binary learners as well, and faculty, and things that we need to be mindful of and very thoughtful and intentional of to create an inclusive space for them as well.
I'll start just by saying I don't have enough experience with that, but here's what I know. I need what they bring. So I'm going to go to them and say, how can I make what you're doing, how can I amplify that, how can I make that better for the whole group? So I'm going to let them lead me, but I think I have to start at the point of I need what they bring, and believe that. And you start there.
The only trans medical student at Stanford killed herself recently. And then the university really did very little in response. And it was really terrible. Yeah. So not great, yeah, at our shop.
I'm sorry to hear that.
Oh, yeah, no, it was devastating. It was
I mean,
devastating.
there's some data and literature. I'll present like one paper tomorrow that talks about what do we do structurally, visibly to invite and ensure there's an environment of inclusion, right? So my name is Cheryl, my pronouns are she, her, right? So straight up off the rip, you just do things, not to be performative, but to really be inviting for people to understand, as we're all learning around the DEI journey, wherever you are, because I don't know everything, I know some, not everything, but we try to practice and actionably do things that can at least lend itself to trying, right? Lend itself to trying, like, we don't say suicide, right? That's, at Emory, we just don't say the word, even though, you know, there's an article in Medscape, what's the problem why we don't say words? It's out there. It's happening. So how do we give ourselves permission, even if we make mistakes, to just call out some of the things that will make you vulnerable, right? And we don't do that well in medicine. That's not our jam. But how do we be bold enough to step out and step in for our trans students, our students and faculty and others with depression and mental illness, to be able to normalize to the degree that this is who people are, so you don't have to spend that time trying to do that while still trying to be a doctor and a resident. I mean, you know, that's enough pressure without having to add those layers on top of that. So it's that demonstrative effort, Kat, of at least, you know, bringing things forward, and to Kathy's point, asking, so how do we do this better? Right?
Can I ask that a little bit?
Yeah.
We actually have a trans third year who, of all things, God bless her, she transitioned during her internship. Just think of that, residents. You're an intern. You're an intern. One of the most challenging years in your entire medical career, and you're also transitioning. And unfortunately, a lot of us had to really embrace this transition in
Yes,
ways that we
learn.
didn't understand, because this individual got misgendered by their pronouns all the time for years. And she's been very open about it. She's been a great educator for our community. And one of the things she said to us was that, look, this is a new territory for everybody. When it does happen, it means so much to me if you, after the fact, come back and recognize it. And just say, I'm learning, I'm trying.
Yeah, exactly.
But recognize their humanity.
Yep.
She said that simple act
Yep,
means a tremendous amount.
yep.
And then add something. So I'm non-binary, I pronounce they them, and it's really difficult to affect that type of change because I understand, especially as a non-binary person, we are all socialized with a very binary view of people, right? And I have the capacity to educate people, right? Mentally, emotionally, I am in a place with myself and the people I work with that I can do that. Not all people are in that place.
Right.
Correct.
Exactly.
Okay? So I would encourage you, there's a few resources I can share, a couple websites, more about, more geared towards like educating medical students on issues like that. Med school, USC at Greenville utilizes those resources. But I would encourage you to seek out that education, that information for yourself, and not necessarily expect it to come from your residents and the people that you're working with. I make a decision, when I put my pronouns in my signature, I make a decision to be visibly queer, and to be that representation, and to risk the blowback that may come to me for that, especially being a non-her.
Bless you.
Right? So I make that decision. Don't put that decision on your trans and non-binary residents. Let them come to you. Let them express that they're willing to be that person. And on the flip side of that, I immediately recognize out of every single person out there that she introduced herself with her pronouns. So that signal to me, it wasn't a virtue signal. It's not her saying I know things and I'm better. That signal to me that she is a safe person to approach should an issue come up. Right? I had this conversation with my brother last night. 'Cause my family doesn't understand. Okay? And he even brought that up. Why are the signatures, have pronouns? Like that's just informative. And I explained to him. Like, I do it to be visibly clear, to be that representation, to be that person that says I'm willing to have that conversation. And you do it to tell me that that conversation is safe. Right? So it's really
So let's see if I'm getting this right. Just like Cheryl said, I bring my whole self. It's not just one thing about you.
Right.
And it's not just one thing about you. You're bringing your whole self.
Right.
And I think that's one of the important things for me to remember is this is a whole person. This is one part of their life, but it's not their whole life.
Absolutely. But it is an important part of your life. So,
No, not
You know
to
what I'm saying?
discredit
No,
it
yeah.
at all,
Yeah.
but it's not the only thing about you that
Oh,
matters.
absolutely.
Right.
And I see that in how people interact with me and the things they talk to me about, the conversations they have with me. The people I work with, the physicians I work with, the nurses, everybody, very rarely talk to me about gender, but they do approach me when they have questions about gender, right? And when you mess up, this is really important. Don't apologize profusely because you're making it about yourself. Okay? So if you misgender someone, they're transitioning, they started transitioning, and you're getting the pronouns wrong, fix it and move on. Acknowledge it and move on, but don't make it about yourself. When you start apologizing, oh my God, I'm so sorry, I didn't mean to, I really respect you, that's now making it about you and making you feel better, and putting me in a position where I have to now give you permission and say it's okay. And it wasn't.
Point.
Just fix it.
Point.
Fix it and move on.
Good point.
Right?
Well said. Well said.
Well, that was a fascinating I think in those moments where like the gender is made much more explicit, and thinking about both the gender stereotypes and trying to expand beyond the gender binary and kind of how we've been socialized to expect things, I guess, can you talk briefly about, do you choose to explicitly name those moments? Are there strategies that have worked or backfired when you specifically, for example, in the conversation with the residents, say, wow, that was an incredibly sexist thing to say about a female resident? Or do you kind of focus on, well, she's very competent, right? Like, do you kind of, what makes you decide to like name it versus kind of, being like water and kind of flowing around it and sidestepping?
Our consultant would say, name it.
Yeah.
Yeah.
Wait,
And
say
that's,
what?
our consultant said name it, and our department names it now. It's not, so in a patient room where, there's an issue of respect, obviously it's Dr. So-and-so is your physician, blah, blah, blah. But then, the naming of it and the discussion is in a hallway, privately with that person and trying to educate them. And, I think one of the ways that we approached it as a group is that we all make microaggressions all day long. So, sometimes you're just simply unaware and you just need to be corrected. And that's sort of the way that we've come at it with this sort of appreciative community. And that allows us, I think, to name things and be up standards a lot more easily. Because you just assume that you're going to do it too at some point.
And I would add to that point, I always sort of say, and I mentioned it earlier in the other group, was what is the goal, right? If the goal is to truly create a community of inclusivity, of belonging, and feeling safe, right? If that's the goal, so what's the goal? Then we have to name it, right? Because if you don't name it, we are not going to reach that goal, because now, whether people feel comfortable, especially if you're in a position of leadership, now if people are like, damn, she didn't say nothing. Okay, so it's note to self. All right, well, let me just go, not even gonna go down that road. So we've essentially shut down that feeling of belonging and the absolute right that everyone has to be in that space. So we have to have courage, and if we don't know how to name it or how to do it, that's how you get the education, and that's how you absolutely have to intentionally seek ways. But silence is violence, right? And we have to figure out, okay, this is awkward, but I have to name it. If the goal is to create an environment of belonging, inclusivity, and people feeling comfortable to that, Dad, I've been happening for 20 years, right? I mean, it's like, you don't say stuff and it's been, kicking the can down the road for a minute until now, things are just crazy. And you're like, what just happened? Where it's been percolating. So name it.
I also think there's a difference between what we teach the individual resident how to cope and how we teach a group of residents and how we have a whole department with the attendings all involved. I think, so I'll just start with a story as a resident. I wanted to get the surgical rotation at the county hospital because there was a lot of hands-on. I knew I'd spend time in the OR doing things, and I wanted that. I didn't want to just be standing on the sidelines. So I worked hard, and I finally got that rotation. When I got there, there was an attending who had come from somewhere in South America, very proud man, and I was working with him, and I had only one hand in that I was holding something, and underneath his mask, he said to me, "Are you married?" And I thought, well, that's a weird question to ask a resident that's there, and I said, "Yes." And he goes, "Well, good. Use both hands. I'm sure your husband taught you to do that."
Oh, my gosh.
So
Yikes.
So I'm in the
This just got
operating room in
very
front of all
racy.
that, and I didn't have training on how to deal with that. I wanted to get a good grade. I really wanted to get a good grade on that rotation. It was important to me. Actually, I was a medical student, not even a resident, and I wanted to help me get my residency that I wanted. So how do I handle that? So the rest of the whole time I was in there, I just was puzzled, and I was really, really upset that he had said that to me. So the nurse actually helped me. She pulled me aside and said, and I'll call him Dr. Rivera, just to call him something. She said, "You need to talk to him about that." And I said, "Well, what should I do?" And she goes, "What you should do is point out that you're a good medical student." So I did. I pulled him out aside, and I said, "I need to know, did I do a good job in there assisting with that surgery?" And he had to say, "I did." And I said, "I don't think that has anything to do with whether I'm married." And I just walked away. And so that was all I knew how to do at that point in my life. I'm sure now I would have more tools in my tool belt. But I'm just going to say, I think I was grateful to the nurse for telling me not to just let it ride. And I think that's one of the things we can do is not to just let it ride. It's important not to let those things go by. It's important to deal with them.
Agreed.
And I think dealing with them, regardless of the role of the other individual, that's a specific issue that, being in leadership roles, we have nursing counterparts that are leaders, and there are certain quality things that come up that, okay, if it's really more nursing practice, your leader is gonna address directly with the nurse. These are issues that when they come up, we should be directly addressing the nurse. It's not a wait until the nurse manager can take care of it tomorrow. It doesn't matter that I'm a physician and that was a nurse that we need to pull them aside and have that conversation.
And in your world, quality, that's a fair and just culture, right? I mean,
Yes.
that's just,
Fair and just.
that's what it
Yeah.
is.
Well
So
said.
that's what it is, so.
Yes, Kat?
So I have a follow-up, and it's putting a little bit of nuance in that responding scenario. So there have been occasions where some well-meaning leader intervenes or responds on behalf of or in support of someone who has just had a microaggression or a macroaggression or been, just blatantly discriminated against, where the individual who was the recipient of the discrimination feels now it's even worse than it was before.
To make it worse.
Right, and so I think that the other part that is important when we're taking these leadership positions is to check in with the person first and say, I saw that happen, that was not okay, I would like to address it. How do you want me to do it? Do you want me to do it with you here, or do you want me to address it later with you not here? Or do you want me to address it at all? And if not, then kind of unpack it with that individual and again, affirm that you're trying to support them and you're trying to impact the environment or climate in a positive way. But I feel like sometimes we shoot ourselves in the foot by trying to save someone that is like, I'm a big girl, I can handle that. Would sort of be my response in some situations.
Well, are you trying to save someone? Again, I don't try to sort of yes, it happened to that person, but I'm looking more at what the environment is and what the culture is. The concern that could happen where somebody said, yeah, I can handle that, they say, we don't know that, and it sort of puts it on them to handle that versus, I'm not trying to not, we're trying to create an environment. So I always go back to the goal. The goal is to create an environment of inclusivity, professionalism, and belonging. And the concern that could happen is if you say, well, do you want me to address that or not at all, right? That could be sort of a reflexive response in a situation where that's just what has historically happened, that should happen, versus what shouldn't happen, and which could then become the norm, if you will, if we say, no, I got this, which in truth, in fact, you may not have this, you may just be reacting, right? So I wouldn't necessarily, if I could say that, say not at all. I would say, I'm gonna address this because our environment, I would bring it back to the environment and the culture that we're creating. That's not okay, right? That's not okay. And, you know, I'm sorry this happened, you know, to you and this happened, but this is not what this is not the environment we're trying to have here. And I think the onus on that person saying that's not okay, I'm not sure in that water, to tell you the truth. Just my,
As leaders, and specifically as leaders in certain niche, as we talk about, you know, academic, women in academic, or diversity and so forth, what are some ongoing difficult conversations that you guys have to kind of be the voice for, or kind of speak up on behalf of other people? And maybe as we talk about like negotiation styles or conflict management, what are some things that you all think have been helpful or useful as you've stepped up as kind of like a spokesperson in certain rooms on behalf of people? What are some techniques or things that you feel like you do in your own day-to-day? When you go back to your communities and people look at you as a leader in this outside of just being like an emergency room doctor?
I mean, I would say number one, and it was on the side, listening, making sure you're listening, and listening to most of these conflicts, and most of the conflicts we deal with day to day. There are two sides to every story, and not that we're judges or anything like that. The truth, most of the time, lies somewhere in between, and whatever that necessarily is, and really trying to listen and understand the perspectives, the values of the individuals involved, that it's not necessarily who's right, and I think Jeannette said that before, getting to what's right, what do we stand for as a department. It's allowing folks to learn from it. You know, I think it's not, and as I talked about even from a negotiation perspective, there's positional negotiation, like I want this, you want that, right? And that's it. There's a line, either that's happening or this is happening, right? Then there's principle. It's like what are the principles and what are the values and of the individual that you're negotiating with. If you ask enough questions to get to that, to get to their emotions, to get to their logic, right? That's where you'll come to more of collaborative solutions. Is-
I think we are kind of running out of time. Maybe we can have final questions from the participants. If anyone has a question. If not, maybe we can.
I sort of have a question, you know, and I think it's a kind of a follow-up to what Kat had asked, which is something I struggle with, and I agree with that this is how we do it as a department. This is what our standard is, and when those issues are brought up, wanting to address it in some way, and I like the direct conversation. I like the individuals involved being able to work it out together, treat folks like adults. At the same time, the one I struggle with was wanting no action. And when you are trying to establish a certain culture and a way we're doing things, and and we want to be good listeners. It's, and you want to be approachable, so you don't want to not, not be respectful of the individual's wishes, because you still want to be approachable. But it's really hard for what we're trying to accomplish overall to not act when you hear about these things.
I feel like, at least from my experience with those particular situations, when individuals are telling me, no, don't talk to them, don't address it, then I ask my resident or my medical student, to unpack that a little bit with me. And I'm like, help me understand what your concern is if we address this. Because a lot of times it's a fear of, retaliation, or it's a fear of
Yep.
how it's going to impact the work relationship.
Yep.
Yeah.
Yep.
And, and so I think that when you unpack it with them, sometimes you can uncover a way to address it generally for
Right.
an entire community
Right.
of colleagues, and say, here's a couple things that have happened recently. And here are some things that we need to be really thoughtful about how we address. So it might be just that you pull a huddle together of the entire department, like, hey folks, I've noticed this. And it's not they noticed, it's like, I've noticed this. I noticed this, and I think that this is a problem. Or I have a concern about this. I have a concern about how this is impacting patient care, how this is impacting our team as, as a high functioning team. And I'm curious from the group, what strategies we should be implementing moving forward. If you don't have any, here's what I suggest we do.
We solicit any instances of mistreatment on students on their final evaluation from the clerkship, and they can, these can be anonymized. And then whatever gets reported for the month, I read them at faculty meeting the following month, and we just all listen to it. And most months there's nothing, but I mean some months there's 4 or 5 things, and they're egregious, and we all cower. But it's very educational.